Hi everyone. I welcome all of you for today's terminology classes. Introducing myself, I am Akshay KM, lecturer from the Department of Perfusion Technology. So, today we will deal with some of the words or terminologies that related to heart or related to cardiac or cardiology. Cardiology is the first term that we are going to discuss in today's class. So, cardiology means study of heart. Study and treatment related to heart disorder and blood vessel is named as cardiology. Cardiologist means the doctor who treat and study about heart disorder or who treat the complication of heart is known as cardiologist. So shortly we can say cardiac doctor. Cardiovascular thoracic surgery or CVTS is the next terminology that we are going to discuss. So, cardiovascular thoracic surgery is a field of medicine dealing with surgical treatment for organ that present inside the thorax or the chest. So, it may help or it commonly deals with repair and the treatment of heart and lung. Arrhythmia is a pathological condition in which improper or irregular beating of heart. So this irregular beating can be too faster or this can be too slow. So improper or irregular beating of heart is termed as arrhythmia. The next term that we are going to discuss is systole. Systole is a stage of cardiac cycle that in which heart contracts. So the contraction of heart during the cardiac cycle is known as systole. The next term that we are going to discuss is diastole. Like systole, diastole is also a stage of cardiac cycle. Actually, systole and diastole are interconnected. After systole, diastole happen, and after diastole, systole happens. Okay, so diastole is a stage of cardiac cycle where heart muscles are in the resting stage. So after the contraction or ejection of blood, heart is at the stage of relaxation where filling of blood is taking place. Asystole is the next term that we are going to discuss. It is a state of complete absence of electrical activity of heart. That means SA node, AV node, Purkinje fibers and bundle of his are no more transmitting the electrical activity. Heart is not pumping the blood. So on the ECG on monitor you can see a straight line. So complete absence of electrical activity of heart is known as asystole. Next, we are going to discuss the term heart rate. Heart rate is a term which are familiar to all of us. So, heart rate is known as number of times that heart beats per minute. So, normal heart rate is 60 to 90 beats per minute, or in numerically we say that 72 beats as ideally, but usually we say a range of 60 to 90 beats per minute. So after dealing with heart rate, the next term we are going to discuss is bradycardia. So bradycardia means whenever there is a decrease in the normal heart rate less than 60 beats per minute, this condition is known as bradycardia. Tachycardia is also a cardiac terminology. So tachycardia normally refers to increase in heart rate more than the normal value. So normal value means it is 60 to 90 beats per minute. So if the heartbeat per minute is more than the 90 beats, then it is known as tachycardia. So tachycardia and bradycardia are just opposite. So if heart rate is decreasing than the normal value, then it is known as bradycardia, or if it is increasing than the normal value, then it is known as tachycardia. So next term that we are going to discuss is heart-lung machine. Heart-lung machine is also known as HLM. So heart-lung machine is an artificial machine that commonly used during open heart surgeries. So we use heart-lung machine as when heart is arrested or when heart is need to be repaired. So heart will not be doing its function. So instead of that, we use an additional or artificial machine to do the functioning of heart, like pumping of blood and oxygenation of blood. That blood is reached to the whole body using the heart-lung machine. Okay, the next term that we are going to discuss is CPR. So the expansion of the term is cardiopulmonary resuscitation. So CPR is mainly given at emergency condition. When patient is undergone cardiac arrest, that electrical activity of the heart is no more. So the pumping of blood to the whole body is maybe stopped. So in order to restart, as an first aid, we give CPR along with pulmonary ventilation. So the next sequence of the terms that we are going to deal are normotension, hypotension and hypertension. Okay, these are come together, or it is a words or terminology that has a close linkages. So normotension is also known as the normal blood pressure. So normal blood pressure has a value of 120 by 80 mm of Hg. Actually, blood pressure is the lateral force exerted by the moving blood on the walls of the blood vessel. This pressure is actually known as blood pressure. Okay, so if there is a decrease in this normal value of BP, then it is known as hypotension. So we can say if there is a decrease in the BP less than 70 mm of Hg, then it is termed as hypotension. Likewise, if there is an increase in the normal BP value more than 140 mm of Hg, it is known as hypertension. Okay, the next term that we are going to discuss is angina pectoris. So angina pectoris is a clinical condition or pathological condition in which sudden chest pain due to temporary stoppage of oxygenated blood that supplied to the muscles of heart. This condition is known as angina pectoris. Next term that we are going to discuss is myocardial infarction, or commonly we call it as MI. So MI is the final stage after ischemia and angina pectoris. That means ischemia will lead to angina pectoris, and angina finally, if not treated, it may at last finally end in myocardial infarction or death of myocardial tissue of heart. So myocardial infarction is also known as heart attack or death of the myocardial tissue of heart. Pericarditis means infection that seen on the pericardium of the heart. So pericardium is the layer of heart muscle. So infection to this pericardium is known as pericarditis or inflammation of pericardium. Pericardial effusion is the next term that we are going to discuss. So pericardial effusion means excess fluid collection that seen on the pericardial cavity of heart. Next term that we are going to discuss is coronary artery disease, also known as CAD. So coronary arteries are the arteries that supplying to the muscles of the heart, that mainly supplies to the layers of heart. So if any blockage or obstruction to these arteries, that leads to decrease the supply of oxygenated blood to heart, that lead to the disease known as coronary artery disease. Next term that we are going to discuss is CABG. CABG is known as coronary artery bypass graft. It is the surgical method to overcome the coronary artery disease and improve the blood supply into heart muscles. Thus, the coronary artery disease can be overcome by the method of surgery. Congenital heart diseases are the next topic that we are going to discuss. So, congenital heart diseases means the diseases that present from the birth itself. So, for example, presence of a hole or a shunt in between the right atrium and left atrium is known as ASD or atrial septal defect. Likewise, there are many type of congenital heart diseases are there that we will discuss later in coming cardiac terminologies. So, with congenital heart diseases, we are come to an end for today's class. I hope this class is helpful for all of my students. Rest of the cardiological terms that we will discuss in the later sections. So, thank you. Have a nice day.